Hello, my name is Dr. Peter McKerrath. You may have seen me before here. I taught a technique on helping with breathing called pandiculation. I'm going to tell you a little bit more about myself, and I'm going to be regularly posting on here. So I have a background in healthcare, been a nurse, a researcher and a therapist, and I've published in this area with colleagues books on reflexology, massage, hypnotherapy and relaxation techniques. They're focused on working with people with chronic illness, cancer and recovering from cancer treatment itself. So my goal is to teach techniques here that you can teach your patients or that you can learn for yourself. So the first technique is called mindful moist mouth. This technique was developed for patients, primarily to use as a rapid technique prior to a medical procedure, such as a scan or the placement of a cannula, like a drip into your arm. So the goal is to moisten the mouth. And the idea of having a moist mouth is it's the opposite of having a dry mouth. When you're anxious, your mouth dries up. Okay, so the goal is to slow down the sipping of the water and to really become aware of how lubricated the mouth and throat can be. So if we take a normal sip of water and swallow rapidly, what happens is that we get a bit of water on the tongue and maybe some at the throat, okay? And we might notice a little bit of coolness in the chest. But if we slow it down and take a sip, and then swallow, then you might notice, or you will notice, that the mouth is fully coated with fluid and the throat feels very nicely lubricated. So repeat this 3 more times, slowing it down. And the 3rd time. And now the mouth feels luxuriously moist, lubricated, and you can really feel comfortable talking, articulating. So this technique is very useful as a calming technique before a procedure. It might also help if you're about to speak to a doctor and you're feeling anxious about the interaction. And it might help you as a therapist if you're talking to colleagues or doing talks. So that is mindful moist mouth. You might find that some people don't like the word moist, so you could just simplify it and call it a calm mouth. So there you go. All you need is water. So go forth and practice this technique for yourself, or if you're a therapist, practice it with your next patient. So look out for more postings here. I plan to build up a whole repertoire of techniques so that you can build your therapeutic toolbox for yourself and for your patients.